Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate through October 27th, 2022. This week, I'm going to address an issue that came in from one of my colleagues, which initially I didn't want to deal with, which is, should I be concerned about political interference in the scientific process? And one of the reasons that I didn't want to deal with it is that sometimes people misunderstand what this is. And if you don't watch this video till the end, you may not have a sense of where I'm going with this. But on the other hand, it is a really important issue. And so I want to deal with it this week in a rational way that I hope is helpful to people. One of the reasons there's concern, of course, is that this emanated, at least in part, from some congressional testimony in the last couple of weeks that suggested the last administration had some interference with the scientific process. But I want to be clear right from the beginning that this is not just about any one administration or any political party. I was in the federal government for 18 years. I saw a couple of examples of what I thought were political interference with different administrations. So it isn't just about the Trump administration or any other administration. And in fact, it's usually not about actions taken by the president or even senior members of the administration. What many people may not know is that there are political appointees throughout the federal agencies. Most of them are absolutely outstanding scientists, people who care deeply, many people who left jobs where they were making more money to come and be public servants. Unfortunately, there were also from time to time a few people in that process who wanted to exert their political views over the scientific process, but generally not people senior in the administration. And also, this is not about situations in which reasonable people disagree. Reasonable scientists disagree all the time. As new information is coming in, we all have to change and adjust our opinions. So this isn't about that. And it's not about the process of each administration identifying their own priorities. But what this is about is situations in which political considerations preclude, interrupt, or replace the scientific process. Instead of a systematic process of gathering and distributing and analyzing data, we have political interference. So normally the scientific process, simply put, is you start by asking important questions. You collect relevant data, either through clinical trials or epidemiologic studies or whatever. You analyze the data and you report your findings. That's the scientific process. But something like the 1996 Dickey Amendment that mandated that no funds for injury prevention could be used to advocate or promote gun control was seen as having a chilling effect on research about gun violence. Now, this doesn't matter at all what your opinion on gun ownership is. This was something that interfered with the scientific process. In 2009, there was a federal ban on funding for needle exchange programs. Again, that stopped people from advocating and evaluating certain scientific processes. And there have been blocks on reports on masks and so on. But again, it doesn't matter in any case what your personal opinion is. Anything that interferes with this process prevents the public from having reliable information. And I'm not the only one saying this. Earlier this year, the Independent Government Accountability Office gave a report on HHS, Health and Human Service agencies need to develop procedures and train staff on reporting and addressing political interference. They moved to protect scientific integrity, which they defined as the use of scientific evidence and data to make policy decisions that are based on scientific methods and processes and not inappropriately influenced by political considerations and not shared with the public, which is what I said in the last slide. And in their study, they did identify federal agencies, federal employees who reported that there had been incidences, but they didn't report them either for fear of retaliation. They weren't sure how to report them, or they believed the agency already knew. So this is an important issue. And there's an easy way to think about it that I think helps depoliticize it. Okay, so it doesn't matter where you choose to get your news or your health-related information. There's all sorts of sources out there that you may trust or not trust. But the point is, you want to know that the information that you get from your trusted source is as accurate as possible, and that the source is free from any limitations from sharing what they believe is the most current and accurate information they have. This is true whether you're talking about a federal agency, a podcast, a news show, or anything else. You want to be able to trust that the information that you're getting is as accurate and current as possible. And the reason that's so important is, say you don't trust somebody. You don't trust the CDC, you don't trust Fox, you don't trust CNN, right? Fine, you don't have to go there for your information. But if you do trust a site, you've got to know that the information is accurate and unadulterated. And so what happens if there is political interference with the scientific process? Right? It results in a long-term decrease in your ability to trust information from a previously trusted source. When that happens, if you can't get the information you want from one source, you start looking for it somewhere else, and you may well find inaccurate information, which again gets out and further polarizes our opinions, which can become a vicious cycle, and we all get further and further from the truth. So at the end of the day, we want to be sure that our scientific decisions are as free from political interference, not political involvement. They're magnificent scientists and legislators and others who care deeply about the public's health and well-being. But here we're talking about interference in the sense of something interrupting that systematic process of trying to learn more information. Because if we don't learn more information, we won't know the truth. There's a great deal more information about a variety of public health issues on our website. Please feel free to share this video with anyone who might be interested, and especially give me your comments. I want to thank Dara Young, as always, for editing, producing, adding captions, and posting this video. And if you have any comments on this particular issue or any other evolving public health issue, please let me know. I look forward to hearing from you. Until next week, please be well. Take care.